Hello, people. This is Dr. Purnima Kulkarni, and I'm back with yet another episode of Boggling Conversations. This is me, your host, Dr. Purnima Kulkarni, and today I have a surprise for you. I don't know why obesity is looked down upon. Why are obese people marginalized, victimized, traumatized, and ridiculed? It is so sad. I read this play called Look Back in Anger, written by John Osborne. And when I read one of the dialogues, it struck me. This face is my face, not yours. I've lived with it for 40 years and I know its faults. I would like to change one word and replace it with body. This is my body, not yours. I lived with it for 40 years and I know its faults. Well, it would be so wonderful if we accept people the way they are. But unfortunately, during COVID-19 pandemic, we have observed that obesity has been one of the root causes of fatality. So today we have with us an aesthetic physician and obesity consultant, Dr. Sheetal Badami. Dr. Sheetal Badami. Dr.
Hi, hello.
Sheetal, hello, how are
Hi,
you
hello.
doing?
I'm
Let
doing good. How are you?
I'm very well, Sheetal. And let me tell the viewers that Dr. Sheetal herself was battling COVID-19 last month. I think doctors, paramedics have gone through hell during this pandemic. So, Dr. Sheetal, tell me something. How did you recover? How did it happen and how did you recover?
Fortunately for me, it was mild. And how did it happen is it's like, I guess it's just everywhere nowadays. So it's very
Yes,
difficult to, to pinpoint who's given you the COVID,
exactly.
It's like
Yes.
every third person you come across is positive, turning out to be positive. So it's just like out there, you know. So, but
I
yeah,
know, I know.
fortunately for me, I had it quite mild. I just had fever and some cold, and I managed with just home isolation and basic medications. So I guess I was lucky. I
Yeah.
should say that, yeah. But yeah, there was some weakness, and
Yes.
apart from that, I was fine. Yeah.
But Dr. Sheetal, let me tell you that you must have worked tremendously on your immune system. And I wish to tell the viewers that Dr. Sheetal Badami is a pioneer of iron magnum technology in India. She is not only an accomplished aesthetic physician, she is a distinguished persona amongst obesity consultants. So it's so wonderful to have you today, Dr. Sheetal. And today we are going to have a boggling session, I'm sure, and I'm going to throw a volley of
Yeah.
questions. And I'm sure loads of viewers, would like to throw a volley of questions like me. And
Yes.
I'm sure you would answer them satisfactorily. And here
Yes.
I go. So, you, as I said, you are a pioneer of iron magnum technology, and you started Define Aesthetics. So, our viewers
Yeah.
would like to know, what is Define Aesthetics all about, and how did you conceptualize the entire thing, the entire obesity
Yeah.
conundrum?
Yeah. So, actually, how did I conceptualize is a bit of it's my own personal story that I would like to share.
Okay.
So, I was always I am trained as I'm an MBBS and as anesthetist. I'm trained as an
Yes.
anesthetist, and I have practiced as an anesthetist also. And then I my daughter was born in 2009, and
Oh,
yeah, and I was always a fitness enthusiast, and I always loved to do my workouts and to keep fit. But after
correct.
pregnancy, I had put on, like, I think 10, 12 kgs.
Oh,
And yeah, and it started giving me, my fitness had gone down, and it had started giving me things like backache and things like that. And I wasn't very happy with that. So I did struggle to lose that post pregnancy weight,
Wait.
because I think it's that's the most difficult time for any woman. So I also
Exactly.
struggled with that. And of course, being always into fitness, I knew my diet, I knew what to do. So I started with my diet and exercise and everything, and I did lose some weight with that. I did lose good amount of weight with that. But that little bit of some targeted fat around the tummy especially, and the thighs and hips, that was
Flabs.
like just, yeah, the flab that was not
Abs. It's
budging.
not abs, it is flabs.
I know. So that was just not budging,
Hmm.
so I then I started to consider options as to how can I get rid of that. And
Correct.
it's as you were saying, it's nothing about it's a personal this thing. I always considered wanted to be fit, so a part of it was important for me to come back to my fitness that I was before. So
Correct.
I didn't I remember I even had like considered surgery at one point of time, but
You mean
then
abdominoplasty? You mean
yeah,
abdominoplasty and liposuction?
I did. Yeah, I did.
Okay.
I did. But I was like, it's just not going with the diet and exercise and all. And what do I do? So I did think about that. And but then, of course, being an anesthetist and being a medical doctor, I knew there are so many side effects, and the hospitalization is there and everything. So I wasn't getting convinced with that. So I started
Okay.
looking for if there are any non-surgical options available, and I visited a lot of weight loss centers, two, three of them,
Okay.
and I
Interesting.
went through what they had to offer for non-surgical weight loss. And obviously, being a medico, and because I understand the physiology and how things work, I could feel that none of that is really going to do anything. Whatever the explanations were given for the techniques or the machines that were being used, they just didn't fit with my medical logic. So I just couldn't understand
Okay.
how it's going to remove my fat. How a massage or a thermal belt is going to melt my fat is what I couldn't
I
understand.
know. I know. It looks horrendous. It
Yeah.
looks horrendous.
So, so it's like that's when I realized that we don't have options available in India for non-surgical weight loss or non-surgical fat loss, whatever, if you want to consider. So I
Correct.
started looking out. I started looking abroad, started connecting with few doctors as to whether there are any technologies available. And I did come across, that's how I came across Iron Magnum. And
Oh,
when I looked at its studies, I looked at the results of some of the doctors. I spoke to a couple of doctors, few doctors in UK. I spoke to a few doctors in Malaysia who have used this, and I went through their results, and I really found it promising. And
correct.
when I went through its data and the studies, the scientific studies, I could it made sense. Medical part of it made sense to me.
Yes.
And that's how I decided that uh, basically I should that's what
Initiate
inspired
the
me to
technology.
sort of
Yes.
I should start a clinic for this, because nothing was really available which was really scientific, to be honest, in
Correct.
non-surgical weight loss.
Correct.
And as I might I was also looking to change of profession, because anesthesia is a very demanding profession time wise. So to take care of the small child, and anesthesia
Yes.
usually has a lot of emergencies, night calls and everything. So I was considering how I'm going to manage that. So I was thinking if I whether I want to go back to anesthesia or I want to change my the stream. So this
Completely.
is when
Yes.
when I came across Iron Magnum, I thought, why not? Why not
Correct.
get this technology in India and start non-surgical weight loss clinic, which would be under medical doctor supervision, which would offer technologies that have medical base, they're
Correct.
proven medically, and which actually are going to work on the fat. So that's
Absolutely.
how actually the clinic started. And
Wonderful.
so initially it was more focused, I was more focused on obesity. And then I came across some technologies which were also for non-surgical aesthetic treatments like facelifts, and also slowly I added those. So
Correct.
that's about me and the clinic. So it is the story is just together,
That's a riveting story, and we are totally absorbed in it, Sheetal. And I must say, you are such a risk taker. I know risk management is a very important corporate skill, and you manage
Yeah.
that risk. You lived up to your patients' expectations, which is a marvelous thing. Tell me
Yeah.
something, Sheetal. Our viewers would also like to know that bariatric surgery is a surgically invasive procedure which is
True.
advised and recommended for patients who are morbidly obese.
Yes.
But
Yes. Very
but
correct.
Iron Magnum technology is a non-surgically invasive procedure. So I think while convincing the patients, do you think the patients are convinced better when they don't have to go under the knife? Because most of them are paranoid. They don't want to go under the knife. They're so
Yeah.
paranoid and so stressed when it comes to surgery. So, how do you
Yeah.
talk to your patients? How do you convince them about this technology?
See, if honestly speaking, if the patient is like really morbidly obese, like, someone whose BMI is above 45,
Hmm.
40,
Correct.
45 and all, then I would myself not recommend non-surgical to them, because they are way too obese to,
Correct.
get results with non-surgical. So for those people, maybe bariatric surgery is a good option. But
All
otherwise,
right.
people who are in the moderate range, for them, basically, it is, many of them don't want to undergo under the knife also, because they do understand
Yes. Correct. Sheetal, are you there? Okay, so we were talking about non-surgically invasive treatment for obesity, which is Iron Magnum technology, and we are talking to Dr. Sheetal Badami about it. I asked her a question pertaining to bariatric surgery. Bariatric surgery is actually recommended to morbidly obese patients, and Iron Magnum technology is meant for people who are not that obese, not
yes,
morbidly
yes,
obese. Yes,
yes, that's
absolutely.
correct.
Yes,
So many of them don't want to undergo surgery also, because they do understand that surgery comes with its own package. There
correct.
is side effects, there is anesthesia, there's hospitalization and everything. And someone who's moderately obese can be given this option.
Correct. Yes, completely understand. Dr. Sheetal, okay,
Yeah,
so yeah,
yeah,
all right. Are you facing any issue there? No, am I audible? Am I clear? Absolutely. Okay.
yeah. In
Okay, so
between, there
Dr.
was some
Sheetal,
fluctuation. Yeah.
okay, so I wish to ask you, you are into aesthetic medicine, and what is the status of aesthetic medicine in India? Is it
Uh,
identified as a mainstream medicine, or you still have to like carve a niche for yourself? What is the status of aesthetic medicine?
I would say, it is still not completely identified as a proper stream of medicine. There are a lot of gray areas as far as aesthetic medicine is concerned. Because when I travel for conferences, or when I talk to some colleagues and doctors who are practicing in Europe or Southeast Asia and all, there is a huge difference there
Okay,
and here. So
okay,
it is still not a very recognized or a very defined sort of a field. in India. I
in
would say that.
India. All
But
right, all right.
I guess the things are changing
Okay,
slowly and steadily. So probably because people are nowadays getting more aware of aesthetics,
correct,
so people are opting for aesthetic treatments more, which
correct.
were not, I guess, 10 years before, 10 years back, that was not the case. So probably as people are more aware of aesthetic treatments and more people opt for it, and I guess things would change.
I'm so glad you ended your, answer on an optimistic note, Dr. Sheetal. But, I have yet another question. Before talking to you, I'm a research scholar, so I did plenty of research, and I realized that American Medical Association has identified obesity as a disease.
Yes, yes,
Okay. So
yes.
why are we so reluctant about not accepting obesity as a disease in India, in spite of reporting so many fatalities during COVID-19 pandemic? Isn't that sad?
It is. In fact, I would like to add to this that in US, even treatment for obesity, whether it's surgical or non-surgical, is covered under insurance or
Yes,
Mediclaim for that matter, because it is identified as a disease. And it is very sad why, in India still we are way behind on that front, because it should be identified as a disease.
yes. It should be identified as a disease because all right. So I asked Dr. Sheetal that during the pandemic, we reported a lot of people with diabetes, with hypertension, with thyroid, and a lot of comorbidities. And all of them, unfortunately, merged with the elements. And people with obesity had to face some complications. So it's very, very unfortunate that obesity is still not identified as a disease in our country. And I think, it's high time that we identify obesity as a disease and do something about it. It's high time that we adopt immediate corrective measures. In fact, I wanted to share something with the viewers. Even when I listen to songs, obesity is ridiculed. हम तो गए बाजार में लेने को रोटी हम तो गए बाजार में लेने को रोटी रोटी वोटी कुछ न मिली पीछे पड़ी मोटी. That is so sad. And Mr. Bachchan, do you remember the song Mere Angne Mein Tumhara Kya Kaam Hai? Jo hai naam wala wahi to badnaam hai. Just remember one of the stanzas. If you're reminded of the song, I'm just going to repeat that line. Jiski biwi moti, uska bhi bada naam hai. जिसकी बीवी मोटी उसका भी बड़ा नाम है बिस्तर पे लेटा दो गद्दे का क्या काम है बिस्तर पे लेटा दो गद्दे का क्या काम है. It's really very sad, the way obesity is criticized in songs. And, these people have to, face a lot of a criticism in gyms, in fitness centers, and lots of places where, lots of places where obesity is, heavily criticized. So I would like to tell the viewers that today's session is specifically dedicated to people who wish to look fitter, who wish to look better. Because after all, there are two options. Either follow dieting or die eating. Do you understand? I'm just, playing upon that, word dieting and die eating. Either you follow dieting or die eating. Either it's fasting or feasting. There are only two options left. Either you fast or you feast. But fitness is something that requires a lot of discipline. Whether it's, like hitting the gym or following a rigorous diet. Some people go on ketos diet. Some people, feel protein rich diet is better as compared to other foods. Well, I personally think anything in excess is bad. Anything in excess is not advisable. So during lockdown, especially when life is sedentary, we can see a lot of people overeating, okay, and putting on weight, and that excessive fat later on becomes fatal. it's not only disgusting and frustrating, you end up looking, you end up, bloating like a jumbo jet. It's really sad. Okay, Dr. Sheetal, are you back?
Yeah,
I was
yeah. I think
I was just chatting with a
there
viewer.
was some technical, I don't know, probably because it's raining, there is some issue with the internet. Yeah,
Okay,
but
okay,
yeah, I'm
all
back.
right.
Yeah, yeah.
So, Dr. Sheetal, a lot of, I was just telling the viewers that especially during coronavirus lockdown, life has become sedentary and people are on the screen for long hours, and obviously they are bloating,
Yeah.
and bloating in wrong places, if I have to be precise. So, Dr. Sheetal, how do we go about, streamlining our lives? Because I was just telling the viewers, fitness is all about discipline. It's about inculcating discipline in our lives. And
Yes.
even if one goes for Iron Magnum, one is, required to, follow a diet. So, how do we
Yeah.
streamline our lives during the pandemic?
I mean, see, to be honest, even if you go for a surgery, you still have to follow a healthy lifestyle later in order to maintain,
Correct.
because ultimately your body is a dynamic being, So even if you take out the fat, whether it's surgically or non surgically, you still have to maintain the balance of calories in and calories out.
Correct.
So, for that, following a healthy lifestyle is very essential. I agree, it is very difficult to follow this with the current situation, with
Yes.
all the lockdowns and the gyms are closed and the
Yes.
online work schedules and everything. But I would say that we still can do at least some home workouts, whatever is
Yes.
possible.
Yes.
Whatever you like, you can do. Maybe it could be yoga, it could be Surya Namaskar, it could be, if you have some equipments like a stationary bicycle or something, you could do that for a bit, or just free
Yes.
exercises. I mean, nowadays with so much is available even online for that matter. If you go on YouTube, there are
True.
so many videos available with workouts,
Yes.
workout regimes,
Absolutely.
which you can just follow.
Yes, absolutely. So, Dr. Sheetal, especially during the pandemic, a lot of patients with, diabetes, and a lot of patients with, hypertension and thyroid actually, touch the lotus feet of the Lord, unfortunately. So, do you think diabetes is reversible? Do you think hypertension and other comorbidities are reversible? What is your opinion about it? Okay, Dr. Sheetal, I, unfortunately lost you again. So I just wanted to tell the viewers that, it's raining a little bit in Pune, and maybe there is a little bit of congestion, and there are internet issues. But I will still talk to you till the time, Dr. Sheetal is back with us. So we were talking about the pandemic, and, a lot of people are, cooped up inside their homes. They're feeling claustrophobic. They are, in this sequestered environment, and it's really sad when you have to, stay cooped up. I know it's disturbing, and some of them are undergoing depression, some of them are undergoing mental health issues, and I know it's really bad. But as Dr. Sheetal said, we can practice meditation, we can practice pranayam, yoga, and we can inculcate the discipline in our lives. We can streamline our lives. Nothing is impossible. Every day, 1 hour is completely yours. It's specially meant for this advice, especially meant for all the domestic engineers I'm talking to right now. Domestic engineer, I never use the word homemakers or housewives. You are domestic engineers, and you deserve to take care of yourselves. You deserve to look after yourself. And for that, if you give at least 1 hour for yoga, for pranayama, or for some kind of physical activity, if you generally go for a walk, or even if you go into silence for a while, I think it really helps. Dr.
Yeah,
Sheetal,
yeah.
why don't you use your phone? Is that better?
That's what I've done now, because I think there
Okay.
is some problem with the laptop, so I've joined with my phone.
Yeah.
Okay, all right. Never mind. I was just, chatting with the viewers because, they are all eager to listen to you. They must be fed up of me, I'm sure, because they constantly see me. Okay, so they want to listen to you, Dr. Sheetal, and I was talking about the comorbidities. So we observed that especially during the pandemic, people who are highly diabetic, or people who had thyroid and hypertension, unfortunately touched the lotus feet of the Lord. I will not use the word died because I don't want to give any convey any negative vibrations through our show. So I'm just using a euphemism for that. So Dr. Sheetal, is diabetes reversible through your treatments? Is it possible to reverse these comorbidities?
Uh, See, some of the comorbidities, see, obesity comes with a lot of comorbidities. To first of all, there is high cholesterol, there is hypertension, there is diabetes, there is fatty liver, and
Yes,
the list is just goes on. There is sleep
yes,
apnea, and so many
yes.
things. And some of these comorbidities are reversible.
Okay.
Definitely, when you and that is, in fact, that is the reason why obesity should be considered a disease, because it comes with so much, and some of these comorbidities are definitely reversible. The moment you lose weight, your cholesterol comes down, your blood pressure gets in control, and
Yes,
the sleep apnea and all. Where as far as the diabetes is concerned, if it's early diabetes or if it's pre-diabetic stage, we can reverse it with iron magnum, or
okay,
any kind of weight loss method for that matter. But if
okay.
it is very late, you've already been diabetic for many years, and then it may not be possible to reverse it,
You
but
mean
it is
type
still
1? Type 1
yeah.
diabetes?
Type
Okay.
1 diabetes, obviously, you can't reverse it because type 1
Yes,
diabetes is basically insulin deficiency. So
yes,
there's
yes.
no cure for it. But even
Hmm.
type 2 diabetic, if you've already been diabetic for many, many years, then it is
Right.
difficult to reverse the diabetes completely, because your
Okay.
pancreas has been not producing enough insulin, as the
Yes,
disease progresses. Slowly the insulin secretions goes down, so then
yes,
it's difficult to reverse it, but with you still can reduce or control it better, because when it comes to
okay.
diabetes, just because the sugar levels, if they are not controlled, if they remain high, then it comes with it really starts damaging your vessels, your blood vessels, your nerves,
True.
and that's when the all the complications of diabetes start, like the it affects your eyes, it affects your kidneys. And so it's important to control blood sugar, and with iron magnum, one definitely can get better control on diabetes. Like, I've got so many patients, so many examples. My own father, for that matter, he's
Okay.
been diabetic for many years,
All
and
right.
like he was diabetes when I started the clinic. He's already was diagnosed diabetic 5 6 years before, and he was initially on oral medications, and then by the time, after a few years, he had just started to take insulin because the sugars were not getting controlled. And
Okay.
then he took iron magnum treatment, and his sugar controlled improved, and he could get off the insulin injections.
All right.
So
Which is okay.
definitely better control we can achieve with iron magnum. And then,
Excellent.
as I
I'm
said, the
so glad.
other complications can be reversed also, like cholesterol, hypertension, sleep apnea. These can be reversed.
Okay, so now I will come to something very significant, Dr. Sheetal. You mentioned almost every comorbidity. You mentioned diabetes, sleep apnea. You also mentioned, cholesterol. But a lot of obese patients uh, are required to go in for a knee replacement surgery because the weight comes on the knees and takes a heavy toll. So, do you think,
Yeah.
with Iron Magnum technology, you were able to probably avoid or prevent knee replacement surgeries completely in some cases?
Yes, definitely, because ultimately the knees are bearing your weight, and that is one of the reasons. Like
Yes, yes,
abdominal obesity is actually the one of the main causes why knee problems start happening.
yes.
And you catch them early, like before the knee is damaged beyond salvation. If you catch them
Correct.
early, then definitely losing fat, as well as Iron Magnum also strengthens your muscles. So
Oh,
when
okay.
we treat such patients, we not only treat their abdominal obesity, but we also strengthen their muscles of their thighs, which can
Okay.
support the knee better. So it
All right.
acts twofold. So definitely we can prevent these patients from progressing towards very bad knee damage and then leaving out with no option but to go in for a surgery. Yes.
Yes. All right. Well, that's positive. I'm sure the viewers would be happy to hear that, because I'm sure a lot of women, a lot of people who have not consumed enough calcium, or who have not taken care of their weight all their life, I'm sure would contemplate Iron Magnum, because if it can be reversed, and if
Yes.
knee replacement surgery can be prevented, there's nothing like it, because that's again, for 15 years you keep a foreign body inside you. I mean, it's really sad and unfortunate. And even after 15 years, it's like a back to square one situation, because I've seen
True,
people
true.
putting on weight even after, knee replacement, which can be all the more
Yes.
dangerous.
In fact, even for somebody who's undergoing knee replacement surgery, if by unfortunately the joint has been damaged so much that see, age also affects the joint. It's not
Yes,
just obesity. So even for those people, losing weight before surgery and strengthening their muscles improves their post-op rehabilitation, and
correct.
the overall this thing. So even for those people, Iron Magnum is helpful
All
if
right.
they lose weight pre-surgery and they strengthen their muscles. Then the post-op recovery is much better in those patients.
Okay. All right. Now, Dr. Sheetal, I will come to a very significant question, and probably this is personal. After delivery, especially, each woman, develops these stretch marks, which can be quite irritating and, quite infuriating. And then you have the celluloid, your arms are, hanging, and, body becomes loose. So what does one do
Yeah.
about that kind of stubborn fat? It is so adamant and it's so obdurate and it's so disgusting, I tell you.
Yeah. Yeah. The most common, as I shared my own experience also, so I guess every woman struggles to lose the post
Yes,
pregnancy fat,
yes,
especially the one that gets deposited around the abdomen. See, what
yes,
happens is when you are considering to treat the post pregnancy fat, you have to consider multiple factors, because
correct.
during pregnancy, to accommodate the growing fetus, your abdominal muscles also stretch. Okay,
Yes.
your skin stretches, your muscles also stretch. So the strength of these muscles goes down quite a lot. And
Hmm.
that's one of the reason, because the skin has stretched. That's the reason it becomes
Yes.
loose, because it can't go back to the normal
Even
distance.
after
So there are,
C-section and after the transverse incision and everything, there's a lot
yeah,
of,
yeah.
yeah,
So
yeah,
there are
fat.
three factors that one has to consider when it comes to post-pregnancy abdominal fat. One is the fat itself, then the muscles have to be strengthened, and the loose skin has to be tightened. So we combine other technologies with Iron Magnum. See, Iron Magnum takes care of the fat and the muscle strengthening part of it. But then we combine other technologies with Iron Magnum, like ultrasonic lipolysis and radio frequency, to help with the skin tightening and the targeted, tackling the targeted pouches
Okay,
of fat. So that's
okay.
how we do it at Define.
All right, all right. You're actually defining aesthetics, Dr. Sheetal, and I'm sure our viewers are actually listening to us. So it's such good news. I'm sure this is music to every woman's ears. Something can be done about that. Stubborn
Yeah.
fat which gets accumulated in wrong places, and
Yeah.
women can't wear low waist jeans, and there are so many outfits, especially when you're in a mall. In the trial room, you actually howl and cry. You shout to the top of your voice, I can't wear this because I'm bulging out of my clothes. So that's,
Yeah.
such a terrible feeling. Such a terrible.
And since you
Yeah.
mentioned about cellulite, even
Yes.
cellulite, for cellulite also we've got a specialized technology called
Okay.
acoustic wave, so which tackles. See, basically our body has different types of fat. Okay.
Okay.
We've got fat that's deposited under our skin. That's called subcutaneous fat. Then
Yes.
there is the fat that deposits in the abdomen around internally around the
Visceral
organs.
fat.
That that's called visceral fat. Very
Visceral
correct.
fat.
And this
Mhm.
visceral fat is the culprit behind all your issues and all your complications and
Yes.
diabetes, cholesterol, and everything. And
Yes.
then women tend to deposit this type of fat, which is like stubborn and tough kind of fat around, especially on hips, thighs, these areas, and that is
Yes.
cellulite. So it's
Yes.
essential to diagnose what is the type of fat that a person has, and then plan a treatment accordingly. So we've got technologies to cover all these different types of fat,
Yes.
and uh, our doctors, we analyze and we examine to determine what is the type of fat that is required to be addressed, and that's how we plan the personalized treatment. So it's not just that the iron magnum or the hifu is there and you just take sessions and you go. So it's not like
Okay.
that.
Okay. It's customized as per the patient's requirement. Yes,
Yes,
that's
yes.
taken into
So,
consideration.
and I think
Now,
that's very essential for probably that comes from my me being from a medical background. So it's always that you never every patient is different. Although
yes.
we get trained, in medicine for certain protocols, and these medicines work on this disease and these work on this disease, ultimately the bottom line is every person is different and you have to treat
Yes.
accordingly. So I guess that's what helped me in designing the customized
Yeah.
plan or
Plans
program
for, yeah.
for
Yeah.
this thing, and that helps with getting results, because otherwise if you try to fit everybody in the same protocol, then you're not going to get results.
Absolutely. It's not a community project like, come people, we have Iron Magnum, for you.
But
It
that's
can't be.
that's
Yeah.
unfortunately, Purnima, that's how so many of the slimming clinics do.
Yes.
And it's unfortunately people still go there and people still invest their money, but that's how
Yes.
they work. They don't have the understanding of the physiology and anatomy, and they don't have applied that knowledge to actually understand the fat, understand the obesity, and then accordingly treat it.
Absolutely.
So
You said
that's
it.
what.
You nailed it actually. Sheetal, if you remember, America actually started this body positive movement, because many women, had body shaming issues, and they started this body positive movement. And suddenly there was an upsurge in plus size clothing, and
Yeah.
all the obese women and men were so happy. They were thronging around these stores, plus size. I'm triple XL, I'm 4XL, and 5XL. I'm so happy about it. So what? It became such a boom. So how do you, as an obesity consultant, how do you look at it? Aren't we actually ignoring comorbidities by highlighting the choice of clothing, etc.? I'm sure retail is doing very well, and people's demands are being met, so they are very happy. But
True.
in
True.
actuality, in the long run, health is what matters. What is your
Yes.
opinion about it?
Exactly. So, you see, obesity is not just about looks. It
Yes.
ultimately, when it starts affecting your health, and
Yes.
then it's too late sometimes to, unfortunately, people start taking it seriously only when it starts affecting their health, is what I've observed
Unfortunately.
in last, 11, 12 years, is that till it is
Absolutely.
just that you are a little plump and it's all fine. And especially with now that you mentioned that now you have so much of the, brands for plus size and all, even the fashion is not an issue, which was earlier.
Yes.
So, it's only when things start affecting their health, when they start getting backaches, these are the early things, the knee
Mm.
pain, the backaches, and, they do an annual checkup and the borderline sugar pops in. That
Yes,
is
yes, yes.
when people start taking the weight seriously, which is an unfortunate part. What I would like to highlight here is that there is a huge difference in obesity in US or Europe and Indian obesity. Okay,
Okay.
because we are genetically different, so
Hmm.
we can't blindly follow the West always. Okay,
Yes, yes.
if you look at even why I'm saying is because if you there has been study which is done in Pune itself. It's called Pune Maternal Study,
Okay.
and the study showed that Caucasian baby, as compared to Indian baby, Caucasian Indian baby was born with much more higher fat percentage. The weight is lower
Ah.
in Indian babies, the average weight, but the fat percentage is much more higher. The Caucasian baby had 9% of fat percentage, whereas Indian baby's average fat percentage was like something like 29.
Oh
So
my
it's that
God.
much difference.
Okay.
Yeah. So it's that much difference. So we are born with more fat percentage.
Oh my God.
So
That's so
at
unfortunate. Yeah.
yeah, so compared to Westerners, we tend to have more fat for a certain weight. So the BMI may
Mm.
be same. BMI is essentially a proportion of your height and weight. So even at same
Yes.
BMI, we tend to have more fat compared to Westerners.
All
Secondly,
right.
because of the genetic differences, we Indians also tend to deposit studies. All this I'm talking about the various studies and data that's available, that we tend to deposit more internal fat for a
Correct.
specific weight compared to Westerners. Europeans and US people, they tend to have more subcutaneous fat and less visceral
Visceral
fat,
fat.
whereas our
Correct.
tendency is to deposit more visceral fat. So that is
Which is
the
dangerous.
reason the
Yes.
complications of obesity are seen much earlier in us,
Okay.
in India. So we can't just follow their standards. Even in fact, even if you look at WHO's classification of obesity, the BMI criteria are lower for Indians and Asians, because the
Oh, okay.
complications are seen, someone who may be severely obese as per the Western standards, but the same complications are seen with even moderate obesity in Indians because of
Oh,
these
all right.
genetic differences. And so that's why I really feel that we should not be following this the Western, these things. Although it's not, body shaming is definitely bad, but that
Yes.
doesn't mean you ignore it, and you
Correct.
wait till it affects your health. So
Absolutely.
that's what I
Absolutely.
think. Yeah.
So, Dr. Sheetal, if I think after your findings, I have, one particular question is lingering in my mind. Is that the reason why childhood obesity has become as common cold in India and even abroad?
Yes.
What is your opinion
Yes.
about this?
Yes.
Childhood obesity. Is it because of pizzas and burgers, or it was always there? I mean, as you said,
See,
it
as
existed.
See, it is. See, I'll tell you. It was, as I said, that we are genetically more prone to big deposit more fat. That we cannot change that fact. Okay,
Correct.
but what we can change it is our environment. Ultimately,
Ah,
any this thing, for any kind of genetic this things, for these things like obesity or diabetes, which are lifestyle diseases, there is genetic component and there is an environmental component, and the
correct.
environmental component is definitely in our hands. And the childhood obesity, I mean, honestly speaking, like when we were a generation earlier, I remember in our school and all, in the entire class there would be one or two people who were overweight kids. And if
Yes.
I see today, I think in the entire class there are one or two people, kids who are fit. the rest everyone is overweight. So it's become that common.
Oh, yes,
And
yes, yes.
what the most dangerous part about childhood obesity is that, see, till the year age of 18, our fat cells not only grow in size, but they also are multiplying because you are
Okay.
growing.
Yes,
After a
yes,
certain age, the fat
yes.
cells don't really grow in number so much. They more increase in size. So when a obese child has more number of fat cells than a non-obese child, because the fat cells are also multiplying at that stage, and that
Correct.
makes you more prone to become to deposit more fat and become an obese adult.
All
So
right.
that
So,
is one of the dangers of, and in fact, I nowadays I've started seeing so many adolescent kids, with insulin resistance and hormonal
mm,
disturbances, all because of the childhood obesity. In
it's
fact,
very
insulin
unfortunate.
resistance
Yes.
or what we call pre-diabetic is so common in adolescence. And if you
Yes.
don't do anything about it that time, that they're going to land up with diabetes at their, like, by the time they're 25, which is very bad.
And probably it's like it's really very unfortunate if this happens, because this is a wake up call to all the parents who are watching this show. I think they should adopt immediate corrective measures, and in case your children, grandchildren are obese, it's high time that we rectify this issue, because it's going to aggravate and worsen. And if your child gets comorbidities at a tender age like 25 and 30, it's going to be a catastrophe. So this is a wake up call to all
True.
the parents, I must say. Sheetal,
Yeah.
after that, I wish to ask you a very serious question. Due to obesity, sexual life goes for a toss completely. I'm sure
Yeah.
you have couples approaching you with certain issues. Their marriages get fractured because there is no sexual compatibility between the couples. So how do you
True. True.
counsel them? How do you counsel such couples?
I think there are a couple of different reasons why that happens. Firstly, a lot of people, because as they start putting on weight, especially women after pregnancy, if they put on weight, their own self-esteem goes down. And I think
Yes.
that's one main reason behind the sexual issues coming in. And also with the obesity, your stamina, your overall, also goes down because you're
Yes.
obese and you're carrying around so much weight. So I think that also affects the sexual performance.
Right.
So yeah, it is one of it's, I think, a commonest cause for that, because if you're fit and if you feel good about yourself, that's only then you are going to be able to have a healthy sexual relationship. So
Absolutely.
yeah, so basically it's all about helping them with the getting rid of the fat that is already there with the help of technology. And we always try to focus on getting a person on a track of healthy lifestyle. We always
Yes.
encourage a healthy diet and some kind of exercise, even little, if with our treatment, so that they can follow that later on and
Correct.
remain fit and remain healthy. So that's what.
Absolutely. So, Sheetal, we have also observed that women with obesity also face a lot of, infertility issues. They have PCOS and PCOD. So, is that reversible through, your technology, through Iron Magnum? Is it possible to, like counsel women?
Yes,
Because have you seen any change, any massive
I
change in their
absolutely.
fertility report?
Yes, yes, absolutely. It is absolutely reversible because infertility, especially PCOD, is related to visceral fat or obesity or central obesity. So, if
Correct.
that is corrected, their hormonal balance improves and the PCOD can be reversed definitely. I have seen a couple of patients who were taking treatment for infertility and their doctor referred them to us to for weight loss, and
Yes.
they after the weight loss she was able to conceive. So That was very touching, experience for me to be able to
Help her
help
out in,
someone
yeah,
in
in need,
in
yeah, in her
that way.
dire need.
So
Yes,
yes,
yes.
yes, yes,
Absolutely. So it's very satisfying when your patients, show positive results, because ultimately, as a doctor, you may be an entrepreneur, you may have conceptualized and, like introduced this technology, but ultimately it has to work. And if it doesn't
yes,
work, it doesn't give you that satisfaction. But I'm sure your
yes,
patients have shown positive results all these years, which is why, Define Aesthetics is a brand in itself, these days. So, Dr. Sheetal, I would like to ask you one very significant question on behalf of our viewers. A lot of people are into, their minds are oscillating like pendulums. So, whether we follow keto's diet or, a no
mhm,
carb diet, the fat diet, and they listen to all sorts of videos, and, their mindset, gets completely affected. So, what kind of diet do you recommend? I'm sure you customize it as per the patient's requirements, but what do you
yeah.
suggest, if you have to talk to the viewers in general?
Uh, if I have to suggest as a general suggestion, I would personally say a balanced diet of carbohydrate and protein. I
Yes,
would not recommend anyone to go on a keto or these kind of diets without
fat
consulting a
diet.
dietitian or a
Mm-hmm.
nutritionist for that matter, because not they may not necessarily suit everybody. And
Absolutely.
if you do them and if they have adverse effects, then you are in a situation where probably you were better off earlier. So it's like a very
Yes,
so so definitely when it comes to us, we do take into everything into consideration and customize a diet. But if I have to give a general suggestion, then important factor is to consider what our Indian diets lack in protein a lot.
yes,
So one should try to balance out. Our Indian diets are high in carbs and very low in protein. So I would say an
yes,
equal
yes.
amount of carbs and protein is what one can balance out. And overall, more vegetables, more fruits. These are the general things. But the
Antioxidants.
important thing is to balance the protein and carbs. So I would
Yes,
suggest that you should try to have equal amount of carbs and protein in your every meal, so that automatically balances it out, and proteins have more
balances it out.
dietary value, so it balances out the entire this thing. And overall, one should try to see how much calories you are eating, you're not overeating. And this thing, a quick, I'll show you one quick this thing. I've done one video also on this. If you want to
Okay,
quickly understand how to do measure control, then this is the amount of protein that should be there in your every meal. The palm,
okay, okay.
this much, the carbo is the carbohydrates what fits in your cupped hand. Okay, two cupped hands is your amount of veggies that should be in the meal,
All
and
right.
what fits on the tip of your thumb is the amount of oil that should be. So if
Oh,
you just
that's
take care
wonderful.
of, like, this is for one meal. So if you just follow this, like this much protein, this much carbs, vegetables, and oil, if you just follow that, and I think it measures, because if you are, if your height is more and if your BM, overall, then obviously your hand is also going to be bigger. So it does
Yes,
sort of fit, that way. So that's
yes.
a simple way I would like to tell what people can do to start with.
That's wonderful, Dr. Sheetal. Now I will come to another question by the viewers. I'm sure a lot of underweight people are watching this as well, because I don't want them to feel that this particular episode is completely irrelevant to them. That there are some who want to get into size zeros. They feel size zero and looking anorexic is in. So a lot of people actually going for crash diets and want to look extremely thin and unhealthy. So what do you have to say? If you're slim and trim does not mean you're fit.
True, very, very true, very true.
If their fat
And
percentages are quite horrendous. I mean, when we check their BMIs, if their fat percentage can, it speaks volumes. So, what is your opinion about, being thin and, fat percentage being high?
in fact, this is a very typical this thing. It's called thin fat phenotype, is what we Indians have genetically. That
Hmm.
we are thin, as in the BMIs are low, but the
Yes.
amount of fat is high. So it's not that just
Hmm.
because you're thin doesn't mean you don't have fat. And in fact, even there are people who are, not very high on BMI. Even they land up with blood pressure and heart attacks and everything
Yes,
because
yes,
of this
absolutely.
particular thing. So what's important is to make sure that your body composition is correct and your fat percentage is under check, and the visceral fat is the most important rather than just your weight or the weighing scale, because your weight is made up of water, which is like almost 60% is water. We all, I'm sure everyone has seen Madhuri Dixit showing that 50% of the body is water. So that is there. And then there is bones, there is organs, there is muscles, and then there is fat. So your weight is not all made up of fat. So it's
Correct.
important to
Correct.
understand that, because many times when you try to go behind losing 5 kgs, 10 kgs, 15 kgs, you're not realizing what you're losing. You might,
Yes,
with even wrong diets, sometimes if you go for the fruit diets or the very very low calorie diets, you lose a lot of muscle and you hamper
absolutely.
your metabolism. So
Yes,
that's very unhealthy. So it's important to follow a healthy approach and to actually lose the stubborn fat, and to strengthen muscle is what we follow at Defiance, because when you strengthen muscle, your metabolism improves and it helps in the maintaining the results long term. So it's
absolutely.
important. Yeah.
So, Dr. Sheetal, that was a valuable piece of, advice. Now, especially during the pandemic, we've realized, we talked about sedentary lifestyle. We talked about, everyone being cooped up and feeling depressed. So, is it an occupational hazard? Because, we talk about workplace hazard. We talk about occupational hazard. So, is this a circumstantial hazard? What do we call this? I mean, this is so unfortunate. You want to do something about your weight, you want to exercise, you want to hit the gym, but unfortunately you have to follow all the home remedies right now, because only essentials are available. So even for one protein powder, people have to wait for ages. So it's such a
Yeah.
difficult situation.
True, true. This currently, I completely agree. It is difficult, this thing, but what I have observed is, if you are, see, this situation is there since last 1.5 year. But
Absolutely.
what I have observed, like in myself or my friend, in my friend circle, or this thing, if you have been fit and you have been healthy and you have been following a healthy lifestyle since some time, a year of doing little less doesn't affect you so much. Like, even I have
Correct.
not gone to gym since last 1.5 year, but I'm not put
Yes,
on weight. you
yes,
know
yes, that's
so
phenomenal,
I
Dr.
so I think it is a lifestyle that matters rather than
Yes.
just whether you do gym. You Even I skip gym sometimes.
Yeah.
Even I do eat out sometimes when I
Mm-hmm.
go out with my friends. But I think it is in the long term, your entire lifestyle that matters rather than. So people say that I eat out one day and I put on weight. I just don't understand how that can happen.
Yeah, how
That happens
metabolism
because
changes immediately.
no, because see, that happens because to begin with, you've not taken care of your health.
Yes,
You know,
correct.
so
Which is
I think that
mandatory.
is
Yeah.
yeah. So I think that is what matters. So because I have not observed people, even my friends who've been fit, who were into fitness or who were into healthy lifestyle, this 1.5 year of difficult time or not able to do the optimal things has not affected so much.
Correct.
So it's
Correct.
all about lifestyle choices, I would
Absolutely.
say.
So it's all, up to us. We need that, determination and willpower to inculcate discipline in our lives. You're absolutely right. So then I will come to the final question, Dr. Sheetal. I'm sure apart from obesity, you're also into aesthetic treatments. You do Botox and medical peels. So
Yes.
I'm sure our viewers would like to know the difference between, what, generally these beauticians do. A lot of beauticians have started using peels, but do they really know that this is a part of aesthetic medicine? And this is not, this cannot be practiced by any Tom, Dick, or Harry. I think this is boggling conversation. So I will call
Yeah.
a spade and, ask you this question. This is a medico's job. So what are those peels all about?
Basically, medical peels are nothing but these are essentially substances which, sort of peel off your very topmost layer of your skin, the epidermis.
Okay.
So again, I would say that, a while ago we were talking that aesthetic medicine is still not recognized as a proper
Mhm.
stream of medicine in India. So I think that is why these things tend to happen, that
Correct.
even salons and non-qualified people are doing these kind of procedures. But ultimately, see, it's like maybe in 80% of people it may not do anything, but it's those 20% people who are going to land up with a complication, and then
Yes.
with a skin burn or a pigmentation and things like that. So I think it's always that, it's for that, this thing, it's important that these procedures are done with under a medical supervision or by a doctor or this thing, to avoid even those 5% chances of complication happening.
Absolutely. You're
So
so
that
right.
is it.
And that has come from horse's mouth, dear viewers. Because Dr. Sheetal Badami is, as I said, is such a, luminary. She's such an illuminating personality. And, she talked about obesity. She talked about aesthetic medicine. And she also talked about inculcating discipline in our lives. And especially during the pandemic, let us take a vow at Reverse Energy that flows, that today onwards, we will take care of our health. May you have robust health, dear viewers. We extend our heartfelt gratitude to Dr. Sheetal Badami, who gave her time. She is a very busy person, but today she, spoke to us and she gave us a valuable piece of information. Thank you so much for your time, Dr. Sheetal. You've been phenomenal, and we are, so grateful to you. We can't thank you enough, Dr. Sheetal. You've been
Thank
phenomenal.
you. Thank you so much. Thank you so much, Purnima, for inviting me on this show, Boggling Conversations, and it was lovely to have a chat with you and the viewers. And thank you so much.
I'm sure our viewers may have a few questions. We are on our respective phones. A lot of questions and comments were actually flashing on the screen, but unfortunately, they're so tiny. So we promised them that, after the live show, we will definitely answer their queries. I'm
Yes,
sure the
definitely.
queries are meant for you, so you will answer all those queries
Yes,
and
definitely, definitely,
requests.
definitely.
Thank you so much,
Yes,
Dr. Sheetal, for your time.
yeah.
So, here's a little advice for my dear viewers. Tough times do not last long, tough people do. And I'm sure we all are very, very tough. We will lose weight and we will regain the confidence that we lost. Thank you so much for attending Boggling Conversation, episode number 9 with Dr. Sheetal Badami. I was your host, Dr. Purnima Kulkarni, and I'm saying goodbye. Shabba Khair. Kindly press the bell icon and subscribe to our YouTube channel, like our Facebook page, and we are also on Instagram. Do participate and stay tuned for all the activities we organize at Reverse Energy that flows. Good night, everyone. Shabba Khair.